Tonight, most Americans are under some kind of stay-at-home order, but the latest state to join that approach is Florida, where Governor Ron DeSantis implemented the order just within the last day. And Florida is also revealing the cost of inaction. It went from just 2 cases over a month ago to over 9,000 now, over 100 deaths, including a nurse who tragically died in Miami over the weekend. That is one more brave person in America giving up her life to fight this pandemic. As for testing, Florida lags far behind states with similar populations like New York. The Sunshine State also facing extra risk because it is home to so many retirees and elderly Americans. About 4 million seniors live there. I'm joined now by Dr. Rishi Ratan, a trauma surgeon, ICU physician at Jackson Memorial Hospital in Miami. What are you seeing on the ground?
Well, on the ground, what we're seeing here in Miami-Dade County and at our hospital is the beginnings of a surge over the last week or so. We're seeing an increasing number of cases every day, and people are coming sick of all ages. In fact, the majority of infections here in Florida are workforce-age people, adults less than 55.
And do you have what you need to get the job done?
We are struggling with PPE as our other hospitals here in Florida and across the nation, as you've heard from our other guests and people are hearing in the news. Our hospital is providing us with PPE, but it's a day-to-day issue of trying to obtain more. We always need more, and we are not currently following, I believe, what the guidelines should be based on the science and based on the evidence that is being put out by researchers across the world, including in countries that are days to months ahead of us that we can learn from, as well as our own public health experts. We need more PPE for our frontline workers, and that's just not just doctors and nurses, but also the janitorial staff, grocery store workers, people who are coming into contact with people that could have coronavirus. We all need more protection.
What are you seeing in patients that need more intensive care treatment or that are at risk of dying? What is the care situation in plain English?
Well, people may start with mild symptoms, but that often leads to a false sense of security. What we're seeing is that a couple days into the infection, people deteriorate rapidly and go from mild symptoms to life-threatening illness or possibly even dead, requiring full life support. And the issue becomes when we are getting more and more people due to this surge, we are in an accelerating phase. The numbers are increasing exponentially across the country. And when we're in this situation, we are facing up against a shortage of ventilators. And there is a chance that we may have to start making decisions about who gets a ventilator and who doesn't, who gets that life-saving treatment and who does not and dies from their illness, if we do not, from the top down, from a national level, start coordinating our response to this virus and getting more equipment.
Do you view that as an avoidable situation?
Absolutely. The situation we're in right now is the situation we're in. As, again, other guests have said, we can't change the past. But looking forward, we have an opportunity to work together at the national level, at the state level, and at the local level for our frontline workers who are trying to save Americans day in and day out. And we have an opportunity to prevent the deaths that have already happened, including colleagues that have worked with side by side taking care of sick patients year after year, and the colleagues that are going to have life.
We've been listening to Dr. Rishi Ratan, and I suspect that we may have lost him at one point. The only other thing I was actually going to ask him about and share is a photo that I think we still have. I'm going to read the caption. It's pretty emotional from some of the doctors there. It says, "This is how we started our morning today. Our team said a prayer asking God for guidance and protection while we are at work and to keep us and our families safe." That's from Danny Rodriguez, who works in the ER at the Jackson South Medical Center. Doctor, I know we had some technical difficulties, but I was just showing viewers the photograph of some of your fellow colleagues praying. I wonder if you have anything you wanted to share about that and how you all are getting through this when you yourselves are obviously working hard and taking risks to help combat the virus.
We're trying to soldier on and support each other. right now, on the national level, I think it feels like we're being sent into battle without armor. Colleagues who are next to us side by side every day, we realize that at the end of this, we may not all still be here. And it's a very sobering thought, and it makes it difficult to do the work that we're doing. But we're, again, trying to come together and work with our state and national leadership and public health experts to try to get PPE out. And the way we do that is to get federal leadership on that and invoke things like the Defense Protection Act broadly so that we can really up the manufacturing of this protective equipment and the life support that will save our loved ones.
Dr. Rattan, I think different people come to this pandemic and this crisis in different ways over time because it sinks in depending on where you live and how you get your information. Listening to you speak bluntly about the risks your colleagues face, about the idea that, like in a war, some of you may not return. It's harrowing. I appreciate you spending some time with us tonight, Doctor.
Thank you. Be safe.
Thank you, and good luck to you.